Good morning. My name is Anuja Tarare. Today's my topic is a informed consent form in clinical research. In clinical trial, one of the step is a consent form. Without the consent form, clinical trial do not start. Firstly, informed consent form defined as all the factor discussed each call as an informed consent form. Consent form has a two type: informed consent form and formal consent form. Informed consent form are through the expression or face-to-face discussion is called as the informed consent form. Then the formal consent form is the writing or email. Through the writing and email, a formal consent form is taken. In the clinical research, formal consent process is high the priority are given in the clinical research. Then the process of a consent form, firstly discussion, then the review, then the third is a consent, fourth is a time, and fifth is a signature. First, discussion between the physician and the patient means the patient are participate in the clinical trial are discussed with the physician. Then the review, information by the nurse or coordination means. Then second step is a review. Third is a consent means all the information, all the consent are addressed. Fourth is a time, allow the adequate time or given time. Then fifth is a signature, uh, signature on the informed consent form. Informed consent form and the population. Vulnerable population are the population that are limited or freedom, are limited freedom, forced to population is called as a vulnerable population. Vulnerable population example is a children, pregnant woman, then the concentrative impaired, then the financially unstable, terminally ills means cancer, HIV, paralysis patient are called as a vulnerable patient. Informed consent form versus and cognitive impaired person or patient. And cognitive impaired person means a coma, mentally retardation, or a loss of memory are taken the informed consent form from the parents or from their guide, from their witness, etc. Then the informed consent form taken from the pregnant woman. No one people are signature on the informed consent form. Only pregnant women are signature on informed consent form. Then the informed consent form versus sedative patient means the anesthesia patient and anesthesia patient as signature on the informed consent form. If they are anesthesia, then the waiting is possible, then they wait or not, or not waiting, so so they replace the patient. Then the informed consent versus minors means participants or patient uh, below the 18 years and above the 18 years means patient have the 18 years or above the 18 years, they have own signature on the informed consent form. Then the as well as the parent signature are also mandatory. Then the patient or parents below the 18 year, then the parents, then witness, and the person who are participate in clinical research, uh, in clinical trials, they the signature on informed consent form. Then the informed consent form are taken from the uh, telephone also. telephone consultation also. This is acceptable in a clinical research. Then the sixth is the informed consent form. And the communication barrier means in any person or patient have do not understand the English language or any language, they have also signature in the informed consent form with the help of a witness and a translator. Informed consent form in this communication barrier, the uh, the translator are given to to um, translate the language and understand the understanding in that patient, so the patient understand and the and sign the informed consent form. So all of this, the informed consent form is the main process in the clinical research. Without the clinical without the informed consent form, clinical trial do not start. So all these are the informed consent form about that.